Welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we're super excited to have you here. We happen to be very crazy passionate about healthcare innovation and adoption. And if this is your first time tuning in, let me tell you a little bit about who we are and what we do here. We're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And our aim is to highlight real people who are truly innovating within our space and give them the platform to be able to share their stories with the world. And we've got an incredibly packed year planned with new content, amazing interviews, and some of them I can't wait for you to hear them. If you haven't checked this out before, make sure you actually go back to some of the archived interviews and check them out. And wherever you're consuming the content, hit subscribe right now so that the content, when it's fresh and out and new, comes right over to you. So I'm really excited for our guest today, mainly because she's been in and around the entrepreneur game numerous times. She's had several battle scars, but today I want to introduce Susannah Bailin, CEO of AC Health. Susannah, welcome to the show.
Thanks for having me. I'm really looking forward to our conversation.
Yeah, it's my pleasure. So I wanted to kind of attack this discussion from a different lens. You know, your accolades, your credentials speak for themselves. However, you view yourself as a patient. So I want to really have this discussion from what got you to want to start another venture, and tell us a little bit of the story that really, the straw that broke the camel's back for you to say, you know what, I think I can do this better, and using your years of entrepreneurial experience, moving into AC Health. So pass the baton over to you.
Yeah, no, great. Thank you so much. AC Health basically was a crazy coincidence. I was in the process of creating technology for thought leaders to help them deliver content to their audience, whether that was their readers of their books or attendees of their lectures. And this would be a platform, primarily an app, that they could record videos, deliver all sorts of content. And I, at the same time, happened to develop a frozen shoulder. I've been in physical therapy for decades. I'm a runner, I'm an athlete, I've broken bones. I was very used to the whole process, right? You come in, they evaluate you, they give you a series of exercises to do at home, which used to come out of a notebook, and they'd write, comments on it or write it all out, whatever. So I went in for a session to try to help my shoulder, which is very painful. And I hope you and none of your audience has ever had frozen shoulder. I actually ended up having two. And the therapist I was going to said, give me your phone. And I said, what do you mean, give me your phone? I'm not going to give you my phone. I don't give anyone my phone. He said, give me your phone. And he was a particularly good physical therapist, and I really didn't want to bum him out. So I gave it to him. He opened it up. He opened my camera, turned on the video, and said, get on the bench. And he recorded me. Do this, do this, do this, do this, do this. And then he said, okay, now get on the floor. Do this, do this, do this. Okay, now you take it and you videotape me. And I left the appointment with 7 videos of either myself doing the exercises or him showing me how to do them. And for the first time in, I'm a little embarrassed to say, decades of physical therapy, I actually did my exercises. I was 100% compliant. Why? Because I wasn't scared I was going to do it wrong. It's one of the big reasons why we patients don't do our exercises. It's not just because we're lazy or forget. We actually can't remember what our therapist told us to do, and we're scared we're going to make a mistake and hurt ourselves. So I didn't have that problem. And it wasn't a piece of paper or an email that I could easily lose or can't find, and it gives me a good reason not to do it. So in any case, I had the experience, and the only problem was that as many times as I asked him to put the sets and reps at the beginning of the video, he always did it at the end. So I'd have to watch the whole exercise to remember how to do it, because once you've done it a couple of times, you know how to do it. and I'd have to go find it in my camera. There was a lot of friction. And one day I'm sitting, working on my platform, and I think, oh my God, I can use this platform for my physical therapist, right? That way I'll have an app where I can click in, pull up my exercises. I can add an accountability calendar. I started thinking from a product development standpoint, like, what else can I put in here, right? And so I went to my next appointment and I said, look, you want to give this a shot? And he said, sure. He was all, into technology, and he liked the idea. And that's how it all started. He added 800 patients within like 3 months. We gave them an NPS survey to see what they thought of the process. And we got a 91. And I thought, my gosh, we're on to something, right? So that's when,
Yeah, I mean, the average score within healthcare, I believe, is like a 75.
Oh, really? That's pretty good, actually.
Yeah. Yeah. So, I mean, it's an A. It's an A.
And if you think about it, it's not rocket science, right? I wish I've seen some of your other interviews, and you talk to a lot of rocket scientists out there. I'm not one, and this process is not one.
Makes two of us.
Okay. I'm replacing paper or an email with your therapist. You're actually taking your doctor home, and we make it very, very easy. And we've added a lot of motivational psych features to reward you for doing something which is basically hard, boring, and painful. And yeah, so that's the origin story.
I think it's really interesting, first and foremost, that I call it like a 2 millimeter shift. So you went from going from paper to then video, but then the idea that the phone is really the vehicle for people to be able to kind of digest some of this information. Interesting how your therapist just, I don't know how they thought of it, but it's very clever to say, hey, this is your phone, you have this video on here. And then obviously you've taken it a step further by refining it and making it even more amplified. Curious, do you find that what about patients that are not visual learners? Maybe they're a little bit more different type of learners, audio. How have you been able to sort of adapt the solution to different types of patients? And then also, what type of feedback have you gotten? Meaning, from an outcomes perspective, is there an output that the solution has gotten as a result of the incorporation of this?
Yeah, so I'll start with the second piece and then move to the first. So the name of the game in therapy, right, from a business standpoint, is completion of treatment, right? You want patients to attend all of the sessions that they have been cleared for by insurance, and or if it's a cash-based practice, that they complete their course of care, which in many cases, especially from a physical therapist standpoint or an occupational therapist standpoint, is not just relieving the pain, right? So you have to mobilize, and then you stabilize, and then you strengthen, right? And so many patients will drop off, right? I feel better, I don't need to go anymore, right? Yeah. Our technology has doubled the number of visits that on average each of our therapists have seen with patients, which again sounds like, that's a lot, right? 100% more. On the other hand, if you think about the agenda for the patient, right, they are going to be more accountable and be more engaged if they have a better relationship with their therapist. And a relationship is is communication between sessions, not just at the session. Yeah. And that's what mobile technology, right, your phone can do. We have HIPAA compliant messaging. You can send each other videos. You can basically As soon as you do your exercises, your therapist knows that you've done your exercises. If you have an issue with something, they can change it instead of waiting for your appointment. And then again, we have a lot of therapists who use our motivational psych features and reward patients. You get points every time you do your exercises. And you think, who's going to be motivated by that? Well, athletes are very competitive people. They want to, have the most points in the clinic. Patients over the age of 65 love points, right? So the engagement is so much greater that the outcomes are better, there are more visits, your revenue goes up. And now with RTM codes, which are reimbursing therapists for the time they spend between sessions, we're now a revenue stream. So those are the metrics of success. Your first question about different learners is a terrific question. Basically the content that our therapists are uploading are three-dimensional, right? They function in space. And so my presumption is that even if you're not a visual learner, it's much easier to follow instructions of a three-dimensional activity by watching it. I mean, we've seen how YouTube, right, and TikTok's new marketing slogan is, I learned how on TikTok, right? I don't know if you've seen that on. So we have been, this is now, we want someone to show us how to do something, not to read about how to do something.
Interesting. It's funny that you say about how the points work. That actually works amazing with kids. So we have it's essentially it's a token economy, but get certain amounts of points and you get this, and work together you get this. So that sort of psychological trigger, it really acts as a pretty interesting motivator. So that's really, really fun to hear that. When you talked about remote therapeutic management, a lot's changed in the last 12, 24 months. Where have you seen sort of the implications of COVID? And now that we're, at the time of this recording, it seems as though we're seeing a bit of light at the end of this pandemic tunnel. Mm-hmm. Have you been able to use that as more of like wins for you to be able to kind of move forward a little bit quicker? I guess, how has it been sort of innovating within this time period? Because you're coming out with something that's new, that's not necessarily traditionally used. You're going up against good enough. You're going up against, it's just easier for me to make a photocopy of something and give it to someone. That's good enough. Mm-hmm. Have you seen the desire for therapists, knowing that there's more and more administrative functions that they have to complete and maybe less time with a patient? Have you, I guess, what have been some of the barriers towards innovation, and how have you and your team broken through those?
Okay, well, that's a great question. The most, the biggest change from COVID is that the generation of 65 plus patients are much more comfortable with technology. Before COVID, because I've been doing this for a while, providers, there's just a lot of myths, right? Oh, they'll never use an app, they'll never use their phone, they don't know how to use their phone, they don't know how to use technology. Well, if you're still thinking that, then you really need to reevaluate, because the research is pretty darn clear, both anecdotally and evidence-based, that patients over the age of 65 are large users of technology and apps, specifically because their cognitive abilities, and I'm joining that crowd now, so I shouldn't say they, I should say we, our cognitive abilities, right, lessen over time. So our ability to remember what we're told, to understand quickly what we're told, diminishes. So having a video that I can watch at home to remind myself, because there's too much shame for me to say to someone, can you talk more slowly? Can you say that again? I'm sorry, I don't understand you, right? So if I have a video at home, I can watch it 10 times, right? No one knows until I can understand it and then act on it. So that's been a tremendous advantage for us, that is no longer a barrier to entry, serving that generation.
Interesting that you talk about that just for a second. I mean, these
Yeah,
stigmas that are often applied to patients, maybe unbeknownst to a clinician because they are so well versed in the language. Maybe what I find is that the best clinicians are the ones that are like the best teachers. They have the ability to explain it as if it's to like a fourth or a fifth grader, and people can kind of digest it. I, Personally, I mean, I've been to numerous physical therapy clinics for various ailments throughout my life. And what always stood out to me was that the best ones were the ones that could speak to me as if I didn't know any medical terminology. And there's something internally that there's a level of connectedness that you have with that clinician.
mhm.
Are you, it sounds like what you're saying is that you're still able to get that type of level of connectedness not only in person, it's also augmented through this different medium.
Yeah, that's exactly right. And I have a lot of contact with new DPT students, right, who are coming out of school.
Okay.
It sounds to me as if a number of those providers who you're talking about are experienced. They've been demonstrating exercises for a long time, and they've learned what works and what doesn't work with patients. These new students, not so much. And the curriculum doesn't, in fact, we have a free for educators program where any DPT program in America can use our technology for free to train their students on demonstrating exercises, because that's 90% of treatment, right? If your patient's not doing exercise at home, they're not going to get better. So you really need to know how to demonstrate it. And that's an art, right? And if you are seeing providers who've done this for a long time, they learn. So we're helping them with technology to be able to add that to their curriculum. But like, as you also said, some people learn audiologically, some people learn visually, some people learn kinesthetically, right? Well, it's the same thing with teaching, right? There's some providers who are naturally fabulous at being able to communicate how to do an exercise. Others, not so much. That's not their skill. They're not verbal. They're not as verbally skilled as they are physically skilled. So they can use this technology without having to worry about how to describe how to do a clamshell. They can just demonstrate it. And they know that if their patient watches it, they're going to do it properly, because positioning is so important. So it's a very simple way of providing the highest quality of content, right? In an accessible, as accessible care. Everyone has a phone. So it's, but as you said, someone has to care, right? The good enough, can it be better? And that's where the ROI really, is starting to make a difference, right? If physical therapists are now compensated for providing that better care, then they will.
So that, I mean, that is the game, right? I mean, as much as we want to talk about innovation, it's the solutions that I have seen that have garnered the most traction are either saving providers money, making them money, preferably both.
Right.
Have you also seen your solution work in other niches within healthcare? Because obviously you have a particular personal experience with sort of the, I'll just call it the rehab services space.
Mhm.
Are there other niches within healthcare that you've explored, and what have you found, with some of those experiments or some of those early, you know, moving into different areas?
Yeah, well, one of the things you learn as an entrepreneur the hard way is that if you try to be everything to everybody, you will be nothing to anyone, right?
That's right.
So when you choose a space, a market, you have to be very disciplined and go deep so that all of your research is associated with a single persona, a single marketplace. It's very tempting to look at other segments. But I've been there, done that. And so I haven't done that so far. There have been I have received calls from other segments of the healthcare system. So for example, a mouth surgeon who has a series of instructions for recovery after surgery wants his own app because our technology is branded for the clinic, right? So he wants his own app with videos of how to take care of yourself post-surgery so that he doesn't have to explain it a million times, so that his front desk isn't bothered all the time. And because our technology is use case agnostic, right? The content is all uploaded by the provider, so it can be anything. We have received requests from other segments, and that's our roadmap, right? That's where we want, that's where we're expecting to go. But at this moment, I am 100% there for physical and occupational and speech language therapists.
What about the creation of content? Let's talk about that, because that's producing high quality content on a regular cadence is really difficult. Have there been barriers? I guess, what have been some of the learnings from clinicians that are trying to create this content? Any notable things to share?
Well, I will tell you that in the last couple of years, there's been a tremendous shift away from fancy produced videos. They're not trusted in the same way that, like, look at this podcast, right? I'm sitting in my house, you're sitting at your office, and we're real, right? We're real. We're talking about real things in our real life. And, that's what, that's what social media has. Facebook Live changed everything, right? All of a sudden we were associated with authenticity. And that's helped tremendously. No one's expecting a beautifully produced content. In fact, if you give it to them, it's not personalized, right? The whole point of my technology is to deliver right now, to deliver what you need right this minute, not what I think patients need, which 3 years ago, that I'm now going to hand to you, right? That immediacy, that personalization, the trust that's imbued, right, through that moment. That's what everyone wants. And what technology has done, which is fabulous in many use cases, is scale content, right? You can send one thing to millions of people in a second. Okay. The reason I did this was to see if I could scale personalized content. Is it possible to make it cheap to use our phone to deliver something that is unique for that person rather than what's standard or general? And it's very exciting, right? It's really exciting to be able to offer this. There are barriers, right? Listen, technology changes very quickly, people not so much, right? Change is, change is hard. Change is scary. You're going to do something differently if you're rewarded or if you're going to avoid pain. Those are the two biggies. So now that there are codes that'll reimburse therapists for providing that remote therapeutic monitoring, and you'll avoid the pain of drop-offs, no-shows, cancellations, patients who don't complete their treatment. Hopefully that there'll be that it'll be easier for people to change.
Have you found that look, workforce shortages are are spanned across pretty much every industry, but healthcare specifically. Are you seeing that the therapists in general are having, with leveraging your tech, are they able to see a higher bandwidth of patients or manage more of a caseload, or perhaps offset some of those activities, the oversight to, I'll just call it other maybe mid-level clinicians, PTAs, rehab techs, et cetera? What has
Mhm.
that dynamic been like?
Yeah, the biggest time saver of the way we do home exercise program technology is that the patient leaves and their care plan is done. So the administrative time that their people are spending now performing that function is replaced. And so if you had to schedule patients with 5-minute or 10-minute gaps so that the note that the HEP can be sent, you don't need that anymore. It's done. I'm not a proponent for factory healthcare, and I apologize for saying it that way, but that's how it feels as a patient, right? You know, how many patients can we see? Throughput. And I understand that that's how reimbursement works. It's how you make money. I'm a business person. I don't begrudge anybody their, their business model. But if the care is deteriorated because of that, we're not going to change the system, but we can change our approach. We can use digital technology like AC Health, and there are lots of other platforms that allow you to deliver the highest quality of care you can in the amount of time that you've been given to deliver that care.
And do you feel like the reimbursement, how much of that do you think is going to impact people actually using and embracing digital technology? And do you find the alternative that if they're to change that reimbursement model, would there be an adverse effect as a result of that? Or do you find that you're embedding yourself deeply within the workflow, that people just natively know that this is actually the ideal thing for a patient? I guess what are some of those motivations, and do you feel like one over the other is going to win?
CMS took years to come up with these codes. You know, there is so much evidence that was accumulated to demonstrate that the relationship, right, the communication between sessions is going to save the healthcare system money. Will it save the healthcare system money, right? That is absolutely conclusive now. Otherwise, they never would have taken the time to create these codes. So the codes are here to stay because they are going to save the healthcare system money. And this is where the friction comes in. It's complicated. Sadly, policy is written in a way that makes it very hard to implement. So I understand it. And I can tell a provider, you can get $19.38 per CMS patient simply by adding them to the app and having them download it and do their exercises. You have to do nothing else. Our system tracks the eval date. 16 days later, we send you a reminder to go into their profile and see that they're interacting with their exercises. You take that report and you send in the claim, and you're going to get $19.38 per patient done, right? But I need to interpret that for them, right? I need it, and if they don't know who I am, and whatever, the description of these codes is terrible. I don't know who's writing these things, but listen, my father was a historian at Princeton, and he taught me at an early age that the smartest people, like as you said, can say the most complicated things in the simplest way. And you will know whether you're talking to someone who is a smart person if they can describe something simply. I don't know who's writing the CMS policies, but Not so smart, right? Because it's so, in any case, so I think that that's a real barrier. I think the real barrier to implementing these codes is that they're so complicated. But I do think that's the future because it's a revenue stream, right? And the PT's pay reimbursement just goes down every year. Every year they're cutting it, cutting it, cutting it. There are so many of these platforms that provide general PT exercises in place of a one-on-one appointment, and they're very profitable. Now, they're not working particularly well, but they're raising a lot of money, and that may be our future, right? Which would be very sad. But I'm very hopeful that the reimbursement codes will reignite providers' sense of empowerment over their expertise, right? That they can really make a difference in my life, because they can, by diagnosing me and then providing treatment that they believe is right for me, rather than whatever is in the library, of their EMR.
So it sounds like then what you're saying is that regardless of how much private equity money comes pooling into healthcare and the consolidation of practices is going to continue to happen, you're saying that the differentiation is going to really be in the hyper-personalization of the care that's given to that particular individual patient. And if the ones that can do it at scale are the ones that are not only going to win, they'll win disproportionately.
And the patients win.
Yes. Yeah.
Which really should be all anyone, I know it's hard, but I remember when my doctor came to my house, they made house calls. They were a part of our family. We had a relationship with them that went far beyond a 15-minute appointment. And we're not going to go back to those days. And I'm not asking anyone to go back to those days, but how can we use this miraculous thing we're carrying around with us, right, to reimagine that relationship? How can we use it? So I'm excited to see what brilliant people like yourself and the other entrepreneurs and doctors and medical professionals who you talk to come up with, because that's that we're only going forward.
So let's talk about the future for a second. Let's just say fast forward a year from now. We're sitting down again, we're having a conversation, and we're looking back. What needs to happen in order for you to feel really satisfied with the growth, with the evolution, with the pushing forward of AC Health? What does that look like?
Of AC Health?
Yes.
Well, now it's going to sound very self-serving.
Well, it's okay. The show's about you. It's not about you. It's about you. It's your time
now. I got into this because I knew there was an easier way to help patients, right? I knew that it was the patient who was going to win from this, and patients, love this. They want to take their doctor home. They want to take their PT home. They want, when they're alone and they're trying to change their behavior in order to heal, in order to get healthy, in order to maintain their wellness, they need support when they're alone. The next generation knows this already, but our generation struggles with it because it's a different model. But I'm very I'm very optimistic because I can see, I'm an outlier as an entrepreneur in my 60s, right? Many of my peer entrepreneurs are in their 20s and 30s, and they're hyper focused on the delivery of, tiny pieces of information that you can collect about yourself, right? And all of that data that they're collecting will lead to an understanding of protocols that will work. With AC Health, that would be my dream, right? I'm collecting all of this data from providers of protocols that they're using to speed up the recovery of frozen shoulder, or speed up the recovery of knee replacement, or any musculoskeletal issue. And they're all doing it their own way. Well, wouldn't it be extraordinary if we could use machine learning to learn, right, which protocols work best on which humans, and then deliver that information so that everyone's not recreating the wheel.
Brilliant. Well, tell us a little bit about, because we have a wide range of folks that tune in, that listen in. I mean, who is your ideal customer? If there's one ask that you can have, just share who's your ideal customer, the folks that you want to be working with, that you feel like you can have the greatest level of impact with. Describe to us in detail, just so that people can know.
Okay. My clients today are committed to delivering the highest quality of care to their patients in an easy way, right? They don't have the time to learn complicated technology. They don't have the time to teach their patients how to use an app or how to use a platform. But they love technology, and they are, they want to know what the new is. So I guess describing who my clients are is probably, the best way to answer your question. I would love to hear from providers who are outside of the physical therapy, occupational therapy, speech and language therapy world, who are looking for an easy way to deliver their approach to wellness, their solution to disease and illness, and have a simple and affordable way to deliver it to their patients on a regular basis. And so that would be phenomenal. I would love to hear from those therapists. These are providers who are very proud of, they're very proud of what they do. They feel as if they know how to heal their patients better than anyone else. They are very confident in their abilities, and they're frustrated by having to use standardized and general content to deliver to their patients. They don't like it. They know there's a better way, but they don't have the time, right? They're too busy. They're busy because they're so good.
Absolutely. What's the best way for folks to follow your work, get updates on AC Health? Give us a little bit about where they can kind of get more information. Sure.
I would love to hear from anybody. That's the best part of my day, is talking, connecting with providers. My email address is susannah.bailin@ac-health.com. I'm sure it'll be on the screen somewhere. We have a website, ac-health.com, where they can get more information. I'm on LinkedIn. We have Facebook, we have Instagram. Any way you want to connect, I'd love to hear from them. And we also are constantly developing new features, right? We are constantly adding what our therapists, what will make it easier, right? Easier and more simple for our therapists to use us. So any ideas that people have, and they say, I wish I could find technology that can do XYZ, bring it on.
Well, fantastic. Well, look, we'll definitely post that information in the description. And for those that are tuning in, if you found this content helpful for you, I mean, would you mind sharing it on social media with your networks? I'm just incredibly grateful when we can connect this information to more doers that are in the healthcare innovation community, because it's about doing, it's about execution. It's not just about sitting here having conversations and going from meeting to talking to meeting. Like, we actually have to do things. So the more innovators, the more action takers we can bring into the community, it's a much better thing. So Susannah, I'm looking forward to reconnecting with you in the future and hearing more about your progress and some of the other success stories. So keep it going, hang in there. Thank you so much for the words of wisdom, and I'm looking forward to our next conversation.
Me too. Thanks so much.